feel the symptoms of tickling in your throat, pinching headache, body aches, fatigue, sneezing and runny nose, it's obvious you got a cold and flu. When you observe symptoms of flu which tends to come on unexpectedly, and continues its situation the 3 or 4 days.
But sometimes, it can continue 1 to 2 weeks and then it starts decreasing and you feel getting better. Viruses of cold and flu.
The viruses of cold or flu can be anywhere around you for few days or more, so you got to take really care that you may not become the victim again. You can certainly feel that the viruses are the offenders behind both of these infections, cold and flu.
You will be amazed to hear that there are about more than 200 viruses that can certainly cause cold or similar symptoms. Among those, the most widespread virus is known as rhinovirus.
Against it, there are 2 influenza viruses, and they frequently transform, needing the flu vaccine to be updated every year so as to defend beside the most recent strains. How viruses transfer.
People can easily get in contact of such viruses which can cause its effects by inhaling droplets in the air. This happens when any already flu and cold infected person coughs or sneezes around them, or simply by coming in direct contact with such person.
The virus can also transfer by using such persons' shared objects or surfaces, and when you touch your eyes, nose or mouth, it easily transfers to you, causing you cold and flu. When the virus moves in your body, it will zero in on the respiratory organs such as nose, sinuses and throat, while influenza can disturb your lungs.
Before the symptoms of the cold virus, which is infective up to 2 days or 3 and remain transferable to the people in contact. However, influenza is infectious just for a single day before its symptom appears and thus remains for up some 6 days or a week.
Medications to get rid of cold and flu. Flu and cold medications are frequently used for providing relief against their symptoms.
However, it is significant to identify whether showing that they work well or not, mainly in children. Such medicines are never recommended for kids under 6, so you should ask your doctor for advice before giving them such medication to kids.
Such medicines every so often comprise of paracetamol, so it is vital to check its label to escape doubling up and using another medicine that also include paracetamol. Some people use vitamins for getting rid of cold and flu, such as vitamin C, mineral supplements i.e. zinc, and or herbal medicines e.g.
Echinacea, which are quite helpful. However, we still do not have enough indication to confirm whether they are fruitful as medication to cure colds and flu.
Antiviral medication. If you are probably suffering worries from the flu and cold, your physician may prescribe required antiviral medication.
Such medicines won't treat the flu and cold, but if such medicines are taken within 48 hours of the symptoms, they can be supportive for the following. It decreases the time you are ill throughout the day.
It relieves many of the symptoms other than cold and flu. It decreases the cold and flu.
These medications serve by preventing the virus from increasing its affect in your body. Concern to your physician to check if antiviral medication for flu and cold is good for you or not. Antibiotics.
It has been observed that antibiotics do not cure cold and flu. Even, they won't benefit the symptoms of cold and flu or end them from dispersing to people in contact.
Because they are wide-spreading infections and antibiotics are not effective contrary to the bacterial infections. People seldom can get a bacterial infection as a secondary disease of a cold or flu.
This sort of infection is not public and many people will get healthier by themselves without using antibiotics. Suppose, if you are at risk of diseases or may get very ill, then your physician may prescribe you antibiotics.
How can you prevent from flu and cold? It is really a fact that you cannot possibly get rid of colds completely. You can simply take some precautions to just lower the risk of catching the cold.
You can wash your hands very time and again using water and soap. Keep scrubbing to rid your hands of germs for often 20 seconds at least.
Be careful and avoid touching your mouth, nose and eyes, without washing your hands. If someone has got a cold, try your best to go near in contact with him, and also be cautious while you are in public areas.